All right, this is a short tutorial on how to use your AED or automated external defibrillator. Your automated external defibrillator is a machine that's going to deliver a shock to your patient, and it is designed to shock only two rhythms. The only two rhythms that this machine is designed to shock is ventricular tachycardia and ventricular fibrillation. Ventricular fibrillation is the most common. Okay, and again, this machine, your AED, is designed to shock two rhythms, ventricular tachycardia and ventricular fibrillation, either one of those. In order for us to put this machine on our patient, your patient has to be unresponsive with no pulse and no breathing. Again, unresponsive, no pulse, and no breathing is a criteria for us to apply the AED. Now, the AED can be used on any patient population. It can be used on an infant, it can be used on a child, and it can be used on an adult. An adult for AED purposes, okay, is going to be anybody greater than 8. So 8 or greater would be considered adult. Anybody less than 8, okay, you would be considered a child. And we just make that distinction because we really have two different sizes of pads. So we have the big pads and then we have the pediatric. If you're 8 or greater, 8 years old or greater, you have to use the big pads. If you're 7 or less, you should be using the small pads, okay? And the small pads, they have a little device on them. It's called a pediatric dose attenuator, which essentially means that it just lowers the amount of electricity. They're smaller people. They can, or they should get a less amount of electricity to them. So anybody up till 8 years old or 7 or less should get the pediatric pads. I will just tell you that if you don't have the pediatric pads, you actually can use the big pads on an infant or on a child. So you can use the big pads on little people. But the one thing you cannot do is use the little pads on a big person. So little pads, if you're 8 or greater, you have to use the big pads. You cannot use the little pads on the big people because they don't deliver enough electricity to them to do what they need them to do. So again, this machine, this is designed to shock two different rhythms. It's designed to shock ventricular fibrillation and ventricular tachycardia. And what this does is that when it delivers a shock, it actually kind of stops your heart for a brief second. Your heart kind of gets stuck in these little rhythms, and it will shock your heart, and then it kind of depolarizes your cardiac muscle, and the hope is that your heart comes back into a normal rhythm. Your heart has a property that's called automaticity, which means that your cardiac muscle or your heart muscle generates its own electrical impulse. Well, when it gets stuck, we'll just say in ventricular tachycardia or ventricular fibrillation, we deliver a shock, it sends it into a brief period of asystole, which is flatline, and then we hope that your heart will come back and generate a good electrical impulse again with a good rhythm. All right, so this machine here, a couple things about it. When we put these pads on, we'll just open this thing up. Let's just talk about this. But you have these pads here, okay? These pads must go on. These pads here, they have little pictures on them, but they must go on your patient in these positions. One is going to be this upper chest area. One is going to be the lateral ribs area. So it's always the patient's upper right chest and then the left lateral ribs. So that is how your pads have to go on. That is the position. If you forget the little pads, most of them have little pictures. So again, when we place the pads on, one in the right upper chest area, one in the left lateral ribs. Some considerations when we put these pads on: we can only use the AED, right? If our patient is in any standing water, so pools, ponds, things like that, we cannot apply the AED. We would have to get them out of the water, put them on a hard, flat surface, get them on the dry ground. We would dry our patient off, okay? So we cannot use the AED if they're in any standing water, no pools and ponds, things like that. The other thing to consider is we have to have good pad contact on the chest. So if you had a patient who's got a lot of hair, a hairy chest or something like that, these pads generally, okay, are not going to they're not going to contact the skin very well, which means it's not really going to work. Okay, so that's a consideration. What we would do is we would take most of these AEDs, they come with little packs or part of your little toolkit. will be a razor. We'd literally take out the razor, we're going to scrape off the hair on the chest, and then we would apply the pads. So remember two things. One is our patient has to be out of any standing water, so no pools and ponds. We would actually have to get them on dry ground. We would dry off the chest. If they had a hairy chest, okay, we would go ahead and take our razor, scrape off that hair, then go apply the pads. And again, the pad placement is going to be in the patient's right upper chest, left lateral ribs. A couple other things to consider. If they have any implantable devices, okay, so pacemakers and defibrillators, they're a little bump underneath the skin. All that you need to do is try not to put the pads over that device. If it can't be avoided, that's fine. Just go ahead and put it on, because we want to put this machine and use this machine as soon as it becomes available. So we want to use it quickly. So just try not to put the pads over the implanted device. If we have any transdermal patches on the skin there, so medication patches, what we would like to do is, assuming that we have all of our PPE and our standard precautions on, is take off those patches and dry wipe off all the excess medication. So that's kind of the things that we want to do before we apply the AED here. And the AED, again, just to make a point, the AED is designed to shock two different rhythms. It's ventricular tachycardia and ventricular fibrillation. Once we turn this machine on, we leave it on, we don't turn it off. Once we put the pads on our patient, we don't take the pads off, we're going to leave them on. All right. That's pretty much it.